Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Mouth breathing habit. It is defined as habitual respiration through the mouth instead of the nose. The problems with mouth breathing are the tongue no longer provides support for the upper jaw, with resulting reduced upper arch size. The vault rises, leading to reduction in the size of nasal passages, contributing to the congestion of nose. The pH of saliva elevates, leading to increased rate of caries. A tendency to upper respiratory tract infections, often resulting in tonsillitis and enlarged adenoids. The moment the child is a mouth breather, the tongue drops to the floor of the mouth. The buccinators continue to push inwards and cause the upper arch to collapse. It is not possible to have the tongue rest and function in the palate and breathe through the mouth. In the chronic mouth breathing child, the tongue falls from the roof of the mouth and no longer provides support for the upper arch. This results in a reduced size and retrognathic upper arch. So, check the figure here. There is a correct tongue posture, so there is normal upper and lower arches, whereas the lower tongue posture resulting in increased buccinated activity, and the opposing activity of the muscle is reduced, resulting in constricted upper arch. In the mouth breathing child, the head is pitched or tilted backwards, increasing the mass of cranial contents in the posterior part of the cranium. If the child is able to improve the cranial posture by establishing nasal breathing, then the cranium will have the opportunity to grow with a more favorable pattern. This improved pattern will be reflected throughout the cranium, including the dental arches. Classification of mouth breathing. It can be anatomical, obstructive, or habitual. Anatomical may be due to short upper lip. Obstructive because of any obstruction in the nasal passage. In ectomorphic children who possess long narrow faces and nasopharyngeal spaces, or it can be habitual type of mouth breathing habit. So the etiology, airway obstruction may be due to enlarged infection produces hypertrophy of mucosa, resulting in enlarged turbinates. Intranasal defects more likely to manifest in adulthood due to traumatic septum or thickness of septum, bony spurs, polyps, or tumors. So any of these defects. Other etiology, hypertrophy of pharyngeal lymphoid tissue. Repeated infection resulting in overgrowth of lymphoid masses blocks the posterior nares, rendering mouth breathing necessary until 10 to 12 years. Enlarged tonsils, which is an also frequent cause of soft palate to rest on the upper ball instead of dorsum of tongue, displace the tongue downward and forward, contributing to open mouth posture, and also possible nocturnal snoring and sleep apnea. Other etiology, allergic rhinitis or short upper lip, obstruction in bronchial tree or larynx, obstructive sleep apnea syndrome, in which child will snore loudly, breathe heavily, and may struggle for breath and stops breathing for 30 to 45 seconds while asleep due to upper airway obstruction by tonsils or adenoids. Genetically predisposed ectomorph, other etiological factor. Thumb sucking or similar oral habits leading to underdeveloped or abnormal facial musculature, and in case of cleft lip and palate cases. So the complaints usually told by a mouth oral breather include breathlessness or respiratory failure, gets tired easily during physical activities, back or neck pain, olfaction and taste impairments, halitosis, dry mouth, wake up choking during the night, bad sleep, daytime sleepiness, dark spots underneath the eyes, sneezing, abundant saliva when speaking. So the clinical features, effects on dentofacial structures include The facial form will be more a vertical growth pattern with increased facial height, increased mandibular plane angle, retrognathic maxilla and mandible, nasal and paranasal hypoplasia, reduction of tongue against the palate. Middle and long run alterations occurring from these alterations may have harmful consequences for the individual's quality of life due to its personal, physical, psychological, and social impacts. Therefore, oral breathing is considered a syndrome and one of the most preoccupying public health problems today.